As a chief medical officer at Pfizer, I hope to provide the different perspectives, the patient voice, and also the scientist, so that the products in the pipeline are used in the way that they are designed, in a safe way and effective way, that they can be positioned to really address the unmet need that is really in practice of medicine. I was born in Asmara, the capital city of Eritrea. I grew up during a difficult time because it was many years of war. Many times you feel like you're going to break, but you bend and you gain courage and resilience along the way. You hold on to your faith, to your family values, to the things that my parents told me, which is to focus on my education and to keep my eye on the goal, and that's what I did. I had patients that were homeless. I also had patients that were quite notable people in the Bay Area, such as CEOs of certain tech industries. So you learn to not only hear your patients, but listen actively so that you can empower them in order for them to be involved in their own care. Patients teach you along the way where the gaps are. And this is where it makes you a better scientist, because then you start to ask the most relevant questions that you take to your bench to really understand which part of your science can really be a breakthrough. And instead of thinking of the incremental, you start to think about cures. As a physician scientist, you are in both places at the same time. I always loved translational medicine. I always wanted to understand mechanisms of disease, because I felt like if we understand mechanisms of disease, we could understand these pathways. We could develop better targets, not only to treat the disease, but hopefully even to cure the disease. To serve as the chief medical officer came at a time when I felt like I could make a bigger difference, a bigger impact. So I didn't want to pass that opportunity to reach many millions of lives. And then there is also thinking about our pipeline. Are we really covering the diseases that either are disproportionately increased in underserved population and communities, whether it's prevalence, but also outcome? It is a big question. We as a team are really positioned in a unique way because we can reach many lives. And we can also leverage the resources that we have to address and close this gap. This is also the vision and the mission at Pfizer, where we see the science will win.